Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. As you know, we are delivering a daily lecture at 5 to 6 p.m. on Radio Sabrang, YouTube, and Facebook media, and we are describing the life from life, how the life was created, how it was developed, step to step, what were the problems in the way of development of this life, and how the life has overcome all those problems. And these problems are considered complications or the diseases. We name them diseases. Here, in this way, we have given you the knowledge about this body, this life, up to the adult age. And after the adult age, we were still going a little back so that you can easily understand our next chapter, that how this big structure has been formed, and what are the components, what are the parts taking part into the construction of this body. So in this way, we are discussing the structures of this body. But before structuring this body, as I told you, if ever there be any questions from the public, so first of all, I would like to address those questions. And after that, we will go to the routine lecture series. What is our routine program? So, in this way, in this way, a question arises. Some of the my colleagues and my friends, you can say the listeners of Sabarang radio stations, they questioned me that how this Ayurvedic, homeopathic, and allopathics are different from each other. And what is the process of individualization? How you can individualize this thing? So, this individualization of the system as well as of the patients we will discuss today. First of all, before starting this lecture, I would like to tell you that the source of medicines, these are different names: Ayurvedic, homeopathic, allopathic. These are the names given by us. And it's the foolishness of us, or you can say the ignorance of us, that after certain levels, after certain principles, we change the name of these systems. What happens when any system is established? It has some principles. And when those principles are not covering all the grievances of the humanity, then the researcher thinks that something else should be added to that one, already running principles. And but the running principle does not allow, according to its own limits, to add anything to that one. In this way, the researchers are bound to give a new name to the new systems. And then that is why we are dividing, we are giving different names to the different systems of treatments by which people are getting their health back. And we name it allopathic, we name it Ayurvedic, we name it homeopathic, and there are many more others too. But most importantly, these three systems are the medicinal system, basically, because there is a urinotherapy, there is a magnetotherapy, there is a various other things, mesmerism, and all those things are running. And the purpose of all the system is to recover this body from sickness or to bring it back into health. Purpose is the same, but the ways are different. And ways are different. Out of that, there are two categories. One, which are using only the internal living power of the body, and the others, they are using the medicinal power and to help this body to recover from the ailments. So in this way, that is why I consider allopathic, Ayurvedic, and homeopathic system of treatments an old fashioned since many thousand years back. In Yunnan, a system was established that is known as Unani system of treatments. And that Unani system of treatment was using the internal power of any substance which can affect the internal power of human body, by which a person is considered surviving. If that power is there, then we see the person is living. If that power is not there, then we say that person is dead. In this way, we are considering any power of the medicines which affects the human power that is used as medicine. And there are different ways to use the medicines, that medicinal power as well. And that is why there are different categories how we can use the power of medications to the power of, you can say, the sick power of the individual persons. Basically, when person becomes sick, it is a sick persons. But still, life is there. Still, power is there. It means deteriorated power. It means diverted power is there. And the purpose of our treatment is to bring that into normal sequences and the normal functionings. And how we use that drug power, how we use the medicines for converting that sick person into healthy trend. So this is mainly the purpose. But in this way, when I name all different systems, just like Unani system, and the same way in India at that time when the Unani system was going on in the Yunnan, in the same way the system of Ayurveda was going into the Indian sectors at that time, and they were using the diagnostic measures by perceptions or by outwardly expressions of the body of this vital force, and then on the basis of changes from the health to the sickness, they have their own measurements to prescribe the different medicines, and those measurements are known as Kaf, Pith, Vayu. In that way, they were selecting the medicines. Now, what is medicines? First of all, it comes to our mind, what's medicines or what's medicinal power? Every substance in this universe has a unique power which is not similar to the other substances or similar type of substances as well. Just for example, I can give you one example of this one. If you see common salt, sodium chloride, if you see alum, if you see borax, if you see sugar cane, all these are whites. If they are triturated in a powder, and you see all are white, and it is very difficult to identify which one is a borax, which one is a just like seeing. Okay, by seeing outwardly, it's very difficult. Then what we do? We try to analyze them. We try to find out the individual characteristics of these substances, by which a different individual name has been given to these substances. And when they are used as a medicines, that individual different characteristic name is used as a medicine. I will tell you why. So in this way, if we say alum, if we say borax, if we say sugarcane, all these have an individual characteristics, individual properties which are given to this substance by nature. By nature, they acquire those type of properties. The property means how they affect. The actually measurement is, the actually identification is, that all the substances of the universe affects our human body, and how it affects the human body, and this, because of that change they produce inside our human body, we name them individually. What the sugar cane will do, borax will not do the same thing. What the borax will do, alum will not do the same things. It means some of the characteristics will be individuals to these substances. So many simple examples you might have heard about that. You can change from the iron particles from the sand, or from the salt or sugar, whatever. And there are simple ways that you can dissolve into the water, and ultimately the substances, just like the sand and just like the iron, will not dissolve into the waters, but the other substances will dissolve it in the water, and we can separate it, decantate it. And ultimately, from this thing, we can use a magnet to attract the particles of the iron, and then we can separate it from the sand as well. So, in this way, all the individual characteristics of individual substances, we are now able to identify them individually by one or the other ways. And in those ways, when we individualize any substance from the similar type of substances, it means any substance who is used as a medicine or as a substance, even you can say, they, that has been given a different name because it has a different individual properties, characteristics, which are given to him by the nature. And that is why these substances are given different names. Now, come to the medicines. What's medicines? First of all, when you go to the market and you buy any substance, just like onion. And what is this onion? It's vegetable substance. It's usable for the medicines. It's just known as a herbs or vegetable substance. Ultimately, when you make medications from this individual onion, means you prove the effects of this onion on the individual human body, and how it proves itself, how it reacts to the human body or the vital force, because it will not act on the dead bodies, it will act only on the living persons. It means its effect on the living human beings is its characteristics. Many things we can identify by a physical experiments. Other things we can identify them individually by a chemicals reactions and all that ones. And after that, there are some of the pictures, by seeing outwardly we can identify them. Some of the pictures, by some experiments, simple experiments, physical experiments, we can identify them. Some of the experiments, by chemical reactions, we can find out that ones. And the same way, there is another way to identify or to individualize the substances used as medicine, that is known as therapeutic way. And the therapeutic way is that when any substance is given to any healthy individual person, and how it affects his vitality, how it affects or makes the changes in his body, mentally and physically, this is his characteristic. This is the individual characteristic. If sugar will be given to any person, it will produce a different kind of things. If borax is given, it will produce a different kind of symptoms. In this way, all the substances which are used to be prepared medications, they all are having their individual characteristics. And we are talking about the allium cepa or the onions. And it has also an individual characteristics, how it affects the human body. That is his characteristic, because onion may be of different kinds. onions may be of different kinds, and but it is used as a medicine. When it is used as a medicine, it has its individual characteristics, which which is not produced by any other similar type of substances. Even what it discharges from the eyes, itchy nose, what it discharges from the nose, all these things, and many other symptoms. We have hundreds of symptoms of this allium cepa when it was proved in the healthy human beings. So in this way, individual characteristics of a substance, when we bring the substance from the market, it's just a substance. When any substance is used as for the preparing of the medicines, it is known as medicinal substance. When a substance is prepared into medicine, into a form of the medicines, then it is known as medicines. And when that medicine is selected to be given to an individual person based on its individual characteristics of the symptoms, how it affects the human body, that is known as therapeutic identification of the substance. So, therapeutic identification of the substance is the main thing by which all the substance of the universe are used to cure the sick persons, to treat the diseases. Now come to the first question. I told you there are many more different sciences, and but most importantly, these systems which are dealing with the medicines. So before dealing with this one, I would like to tell you the store, the source of making medicines from the universe is the same for all these systems who are using these substances as a medicine. Just like we have categorized, most of the medicines are prepared from the vegetable substances, grass, vegetables, herbs, and all that. And all these things are considered as vegetable kingdom. All the medicines which are prepared from the vegetations of the verse of the universe all over in everywhere, that is known as vegetable group of the medicines. And then after that, second group is the mineral groups. There are various type of minerals scattered throughout the universe, and we collect them, and we have also identified them, or their an individual effects on our human body, that how they affects the human body, just like how the gold affects our human body, just the iron affects our human body, just the different other copper and all those things affects the human body. That by knowledge we have collected the individual effects of each metal type of substance or the mineral type of substances, how they affect the healthy human beings, and how they affect the healthy human being is their characteristic, is their therapeutic identifications. In this way, first thing the vegetable group, second thing is the mineral groups, the other thing is the SAR code. SAR codes are considered when any healthy serum of a healthy person is used as medicines to affect the other individuals, those who are sick. Just like hormones, thyroid hormone, testosterone hormones, pituitary hormones, and there are many more hormones. We know that we will let you know about the when we will go to the chapter of hormones, we will discuss everything about that one. But these are known as sarcodes. These most of the medicines are prepared from the healthy human being's serum. This is type of serum. When we extract the testosterone hormone, we extract the pituitary hormone, we extract the thyroid hormone. It is the extract of the healthy person's organ, healthy person's gland, which produces the hormones. In this way, this group of medicine is used as a SAR code. And now the medical science has developed too far. It's finding out any characteristics, any source of medicines from all type of substances which are prevailing on the universe. And the second group comes the disease products. Most of just like the rabies was prepared by Louis Pasteur. In the same way, most of the secretions or the excretions. Secretions are concerned with the sarcodes, and excretions are concerned with the nosodes. When any excretions of the disease product of the diseased person is used for making medications and has been proved on healthy individual beings that yes, it can affect the human beings in this way and can help us to relieve this kind of symptoms, we consider them as a medicines. We use them as a medicines. And this group is known as sarcode and nosodes. So these are nosodes. Nosode medicines. There are various types of nosodes as far as our knowledge is concerned of the human body, and what type of disease products, what are the healthy products we can take from the human body and can and know their effects by using it on the healthy human beings, how it affects the human body. Those serums, healthy serums, those disease products excreted out of the body, just like the sputum is used. In same way, urine is used, sweat is used. All these things are used for preparing the medicines, and now we know the effects of these medications prepared from all these excretions and secretions, how they affect the human body. And if we know how it affects the human body, we can use this medicine property of this substance in two ways. One, against the symptomology of the sick persons, or in a similar way. In a similar way, whatever the person is suffering. So when we are using all the properties of any substance which is used as a medicine from any group, vegetable, mineral, sarcode, nosode, and there is one other group also we have created, that is imponderabilia, where the medicines are prepared from the powers, from the X-ray power, from the sun rays, from the moon rays, and the various these kind of sources which are not visible but they affect the substances in the universe, just like the sun's ray affect the water. Is this sun's ray affects the plants and all that, even the human bodies. So in this way, when the power of these type of things is used to prepare the medications, or their power is transmitted into any inert substance we know of, just like water I told you, then this group is known as imponderabilia. Radium is also used for this one. In this way, there are many more other substances which are used for preparing the medicines, because we know in healthy persons, if these things are used, it will produce this kind of symptoms even in the healthy person, which will be considered as a disease. Just simple thing. Simple thing, if you go into the sun and you have sunstroke, if you go into the sun, you have blemishes, discoloration of the skins, sunburn, it means these are the effects of those rays. And we know the property of the sun's rays nowadays. And similarly, when we know the effects of this kind of any power which is acting on the human body and change the human body structure as well as mentally and physically, they are used, when it is known to the human body, they are used as medicines. So this next group is generated as imponderabilia from the individual powers. So now we know the power of each group, know the power of medicines of each group, how they affects the human body. Now it's up to us how we have to use that one. one medications, one substance you can use against the functioning of the sick person, against the functioning of the body of the sick person, or you can use the power of these medications according to the same directions which the body is going on. But very simple, easy language I'm using for this one, so that you can understand this one. For example, a person is having nausea, vomiting, and it is because there are some type of toxin, some type of substance has gone inside the body which is not accepted by the body, which is not suitable to the body, and that substance, body or the power of our life wants to expel it out from the body. No more required. In this way, the nature automatically create a reaction that it will create vomiting to expel it out. But if it has gone too far in the intestines, in the digestive canals, after eating, it has taken some time and it has gone too far to come back in a reverse order and come out of the mouth, it is difficult. Then the nature start another process to evacuate this thing from the body, and it will produce diarrhea. Now, as far the treatment is concerned, one way is that you will use the medicinal power to stop that nausea and vomiting forcibly. It's not the right way. Even in allopathic style of medications, whatever the symptoms are told by the patients, doctors are prescribing the medications in such a way that they can suppress those symptoms, not cure it, not understand what the nature wants to. But this is prevailing. Ultimately, that medication will suppress those symptoms up to a limited time period, so that till that medication will be evacuated from the body by other means. That as long as it is still inside the body, it will snub, it will stop that kind of nausea and vomiting, but it will create untoward reactions. It will not be producing some of the symptoms which are not desired. Or there will be, if it's the toxicity of the substance you have taken in is more, and your medication is not covering that one, ultimately it will produce diarrhea. Because nature, for the survival, nature wants to expel it out from the body. And then, if it is a long term disease, if it's a long time process, under those conditions, it will produce diarrhea. On the first instance, you know that these symptoms are produced that we have taken or eaten anything, swallow anything which was not accepted by the body, and the body is producing vomiting. And on the other thing, if you know that, further you will advise the patient not to take those things. And as far as your suppression is concerned with the medication, by producing forceful reaction, oh, not to vomit, sometimes sometimes it becomes very difficult for the vitality to accept these type of things. That is why people say, I'm not feeling well, doctor, this medication is causing some type of problems in my, it's a palpitation, anxiety, and all that can produce, until that thing you have taken in has been digested, and ultimately the medicines you have given will automatically be dissolved or be evacuated from the body, because there is a nature's process inside our body that whatsoever you take inside as a medicine, as a food, whatever, ultimate the necessity of the body will be squeezed from this substance, and the waste product, the rest thing is waste thing. The waste thing will be evacuated from the body later or sooner, depending upon the time periods. Means if you take a medications, it has a limited periods, and till that it will suppress your symptoms, whatever symptoms you are having, pain, indigestion, nausea, vomiting, whatever. This strongest medications will suppress those symptoms, and ultimately, till that, if your indigestible things has been digested, the credit will be given to that medications, that yes, when I take this medicines, it has resolved my issue, because there was a limited period of that substance which you have taken and produced the vomiting to be dissolved, to be digested. Or this medication has a limited period to stay inside the body. Otherwise, process of the body, the function of the body is to expel every unwanted thing. The medicine is not unwanted things. Unwanted is that unwanted substances which has gone inside the body should be evacuated. It's not no longer desired by the body. In this way, but forcibly, you are suppressing that thing. And till that, if that substance is not dissolved, then the time period of this medicine will be over. Again, you will need the same medication to suppress the similar type of symptoms. Just like I can give you one example. A person having a pain, and whatever may be the reasons behind that, indigestion, whatever you have eaten, you have a pain. And ultimately, the doctor of the allopathic style, which they are suppressing, they are giving the medication to suppress the function of the body, so that in the meantime, ultimately, that thing will be dissolved, digested, or evacuated from the body. It will block the function of the nervous system, so that the brain will not have a signal of pain. But this paralyzing of the nervous system will remain only up to the period until this medicine is evacuated from the body. And when the medicine will be evacuated from the body, till that, if the things you have eaten and produced the vomiting will be evacuated or digested, the credit will go to the medications. But just think, there is a cancer inside the body, and that was producing cancer in the digestive system, that were producing the vomiting and pain. Then that's not going to be relieved in a few hours. That may take a longer period, months, years together. Ultimately, you know the condition and you know the prognosis of the cancer type of patients. So what will happen? The time period of the medicines, whatever you are giving to suppress these symptoms, will be over after short periods. The person will suffer from the similar type of disease. It's not a curative process. And ultimately it will reappear on the system, and you need to give the same medication continuously, and ultimately your system will become more weaker and weaker to bear the effects of this strongest medicine you are giving to relieve the pains. And this is what happening in the cancer type of conditions and all that, well, that they are giving morphine, pethidine, or all these things, painkillers to relieve the pains, and ultimately the dose is increasing, because it's not the treatment to relieve the things inside which is causing pain. That tumor, that destruction of the tissues, that is causing pain. Until they are recovered, this pain will not go. And these painkiller medications are not the proper treatment for that one. And even the system itself is not competent to resolve this issue inside the body of the cancer and whatever it is in a short period. In this way, regularly, you have to take the medicines continuously. And ultimately, your system will be ruined, will become more weak, and you will not be able to bear all these type of medications. So this is what happened happening inside the other modern type of medications nowadays. And every day you see the patients are going into the hospitals and doctors. There are big chains, and most of the patients are saying the similar type of symptoms. Every time they go to the doctor, they are having similar type of symptoms, because the doctors are not going deep to the reasons behind those, behind that disease, that's which is producing the pain, which is the abnormal things or disease, sickness. They're not going behind that. And even if they go back up to the materialistic value, means until they see any bacteria detected in the sputum, in the urine, in the stool, and whatever excretions, they say, no, we do not know about the disease. But when they find out any type of bacteria or this that type of disease producing, they say it's disease producing organisms, then they declare, oh, now we know that how we can kill this bacteria, and ultimately they try to kill that bacteria, and their treatment stops at that time when the bacteria are no more visible in the sputum or in the urine or in the stool or in whatever. But the condition remains the same. Why this person was having this kind of problem, until the reasons behind that, reasons which were producing this type of condition in the person is not removed, means not advised to overcome these kind of causative factors, he will come time and again with the similar type of symptoms and with the similar type of diagnosis. Even in tuberculosis and all that, they in the medicines who are recurrent medications, recurrent diseases, the patients are taking the recurring similar type of medications, they are repeating it, because our treatment way is just whatever the symptom is, how the symptoms are produced by the system, our medications are suppressing that one. We know the property of these drug substances, and every substance has a double type of function, I will tell you later. So in this way, second one thing comes into my mind, that this is all about the toxic substances we are introducing into the body by swallowing or by inhaling or by anything we are giving. But sometimes this type of conditions happens because of some changes has taken place inside the body, which is producing similar type of symptoms. But you have stopped everything from outside. It means whatever is producing this type of nausea, vomiting, pain, or everything, it is internal, because the disease producing causative toxin substances are external and internal. So external things, yes, you can find out the way that this is what I am eating, this is what is in my routine, and that is producing the symptoms, and now body is not bearing this thing. Ultimately you have to stop that, and ultimately you can recover that. But the thing, if these type of symptoms are produced from the internal damages inside this, just like kidney failures, and there's the uric acid, and there are many other toxicity produced by the internal damages of the organs, liver, pancreas, all these things, then until that organ is recovered, the person will not become comfortable. He will be having continuously those type of symptoms. In this way, exo and endo type of causative factor we know, but our question was concerned why there are different type of system of treatments named as allopathic, as Ayurvedic, and homeopathic. Again, we have come to that conclusions that now we know what is medicines. Medicines means any substances whose property, natural property, what the God has given to him, individual character. Just like I told you in the beginning of my lecture, that Every substance in the universe has its individual effect on the human body, and that is his individual character. And how it affects the human body, we use this power, we use this knowledge to give it to the sick persons. And what way? First of all, forcibly suppress this. But whatever the function is produced inside the body because of some any elements, any toxicity, to go against that. No, you are not allowed to vomit. Body wants to vomit, but you are forcibly stopping that one in spite of that you know what's going on, why it's going on, and you are relieving why problems of the persons, that why he was vomiting, why he was having a headache, why he was having any type of sick symptoms, to go back to relieve those things permanently, that whatever is causing this kind of symptoms, you can relieve that. But the folly of the medical science is this: as a modern medical science, we are trying to give immediate relief to the patients, and making numb to the nervous system. So from the sick organ, from the sick area of the body, the signal will not go to the brain that he is having this type of problems over there. You are numb the nervous systems. But that is not a permanent thing. Yes, in short, it is used because widely most of the things are produced in acute conditions, in a day-to-day eating habits, in day-to-day environment things, and you can change all those things and you will be okay. But in case of chronic conditions, endotoxins, and also the chronic conditions which are inside the body and already producing the toxins and already producing the symptoms, various symptoms for which you are giving the medications, that takes a long time, and you have to follow this thing until that underlying cause has been removed. You have to repeat the medication to suppress the pain. And nowadays we see that ultimately they end the life of the persons, because it's not cured in a timely fashions, but the disease goes on increasing and increasing, and ultimately pain goes on increasing and increasing, and you are increasing the dose of the medications forcibly to suppress those pains, forcibly not to send this signal from the sick organ to the brain to feel pain. And the purpose was, I'm telling you, that the purpose was to use the medicinal substances, whatever its property was, how it was affecting the human body, to use its material symptomatology, use it forcibly. That is why there is a dose. That's why there is a dose. This milligram, this milligram, this thing should be given in this milligrams, and there are specific degrees of the doctors that who can prescribe this medications up to this milligrams, who can prescribe this medication up to that milligrams. There is a different responsibilities of that one, because we are forcibly suppressing the things but not curing. This is what going on in the modern medical thing. Now come to the Ayurvedic system of treatments. Mostly the crude form, the natural crude form of these substances is used, and the same thing happens, though they are little more safe as compared to, just I can give you one example. Suppose if we give opium to any person, if we give you can say the poppy plants, powder of the poppy plants or poppy flowers, to a patient to suppress the pains anywhere, because pain is the shortest word to express our disease, to express our condition. This is the shortest word to explain. So that's why I'm using pain. So to relieve the pain, suppose I'm just giving one example. If you use this poppy flower powder shape or decoction shape or whatever, this is known as the Ayurvedic. What it is doing? but it's a little safe because the large amount, but with less concentration of the active principles of that poppy plant is used, and it is a little bit safe as compared to the opium. If from the poppy plants you derive, extract the opium, and even the smallest excess dose can cause some severe symptoms or may cause death even. And ultimately, from that up to that opium, we are saying it's Ayurvedic. It's a natural form. But when from the opium we derived morphine and pethidine, these are more minute things, more power of that opium plants. In medical terms, it's known as active constituents. These are the active constituents. What is in the poppy plant which affects the human body? That is known as active constituents. So these are the active constituents, morphine and pethidine of the poppy plants. And as it becomes minute, it becomes more virulent, more dangerous. You can say the more powerful. If you do not want to say the more dangerous, you can say more powerful. And to use the more powerful things, you need more expertise. You need more knowledge about that one. This is what's going on, and degrees of the doctors, and they, oh, you can prescribe this medication up to this thing. You can prescribe this medication up to this thing. Ultimately, they have given degrees because of the precautions. Their knowledge of their degrees, they give them power to use all these things by law. It's by law, basically. To supervise the law, the different doctors are prescribing different type of dose of the medication, the same thing. But just like I give you the example of poppy plants, the actual active constituents of any substance is that chemical which affects the human body. Even if you take decoction of the poppy plants, if you take the opium, if you take the morphine or pethidine, the ultimate the substance is the same. In this way, every substance has this kind of active constituents, and these are the active constituents which produces the therapeutic identifications, which are responsible to tell you the therapeutic identification of a substance. And these are in minute doses, smallest doses. And this is the way of, you can say, the from natural Ayurvedic up to the modern medical science, that is known as allopathic style of medications. And the superiority or the super degree of the doctors are required to advise or to prescribe this kind of medications, but the effect of the medicines are not changing. With the degree of the doctor, effects of the medicines are not changing. And ultimately, this body, you can say the response of the body or capacity of the body will not change. Ultimately, it will be deranged, it will be damaged. And that is why the doctor will say, hands are up. Now we're going to do anything. Because it's not the proper way. It is just the management temporarily. It's not curing the disease. Now, this Ayurvedic and homeopathic, though they are just like the shadow of each other. Ayurvedic little bit same, whereas and using the natural substances, whereas the allopathic type of thing, they are using the active constituents of the substances, medicinal substances, and they are more dangerous, you can say, complications. Ultimately, we come to the homeopathic system of medicines. Now, property, we come to know that the property of a substance, how it affects the human body, depends upon the active constituents of any substance. Anything which is used as a medicines, from where the medicines are prepared to be used in any system, Ayurvedic, allopathic, homeopathic, whatever, they are having their active constituents. Means the individual characteristic or the individual properties which are given by the nature to him, which are individual from the others. They are not similar to others. And basically, sometimes symptoms are produced, they look like similars. uh, Even the substances, they look like similars, but still there are, just like I give you the example of this sugar cane and borax and and this salt, sodium chloride, all these things, they are looking, if they are in powder shape, they are looking similar, but there are some characteristics given to these substances by the nature. And by the nature means, how we know that? We know that how these substances are affecting to our human body, because we are using it as a medication. And when we have to use these substances as a medicines, it means that we know the active constituents of the substance and their power of each and every substance is individual, and the individual power of any substance depends upon the active constituents inside that, which the property, inherited property of any substance given by the nature to him. And this way, each and individual substance which is used for the medicine is individual. The same way, all the human beings, there are many more green vegetables. There are many more salts. Salts are salts. There are many more serums coming from the same body. Thyroid hormone, testosterone hormone, pituitary hormone, many other hormones, cortisol hormone, many more hormones are coming from the same body, but their characteristic is different. In this way, in this way, our body has a different characteristics, a different type of, you can say, the active constituents. eh? That is why whenever our body reacts with anything outwardly in the universe, substances we eat, environment we live in, everything, every person reacts differently to all the substances. It means the human beings are also individual. Even the twin persons, they may be physically similar to each other, but their reactions, their feelings may be different from each other. Realizations means mental and physical. We are living beings, and the living beings are having a mental faculties other than the physical body. And in this way, all the individuals, if bodily they are looking same, similar, twins, but ultimately, if we trace, if you find out their mentality, it will be different from each other. It will not similar to any other. Most of the characters may similar. Most of the characters may simulate to the others, but there will be at least one or two or anything which will separate this person from the other similar type of persons. It will separate from the similar type of twins even. That is why for the individual sick persons, we as a homeopathic doctor select the individual medications for each case. And the last thing for today's lecture, I would like give you a simple more examples. We have 4 5 pots having different colors in each. And then after that, we have one another in unique color. We are adding to these different parts of the colors that unique color in each. Persons are individual, their characteristic is individual, their mentality is individual, feeling, reacting to the environment, reacting to these different type of foods, everything. Every person is an individual. In this way, I'm giving you the example that we have few pots of different colors, and we have a one unique color. We are adding same color to each pot. What you will see, they are not creating the same tint. They are creating individual characteristic, individual color in each pot. And by saying this one, I want to convey you, if there are 10 people suffering from malaria, a person is individual characteristics, individual constituents, individual type of active constituents working on that one, the life force. In this way, when this malarial type of thing, when any disease type of thing which is producing an individual characteristics, it is known as malaria, it is known as plague, it is known as cholera, whatever, different names of the diseases. When they are affecting to multiple peoples, they will produce some of the symptoms not similar to others. Some of the symptoms, individuals to individuals. Just like all of you know about the symptoms of the malaria. There will be fever, chill, fever, sweat, and fever is gone. There may be a gap of 1 or 2 days, and ultimately the person again will suffer from the same conditions. This is the characteristic. Oh, we say you are suffering from malaria. We can say that. Similarly for the cholera, similarly for many of the other diseases, on the basis of some characteristics of the disease, not of the individual, of the disease, that this kind of condition, this kind of disease producing organisms, or the impression produces this kind of change in the individuals, in all the individuals having the similar type of, and then those similar symptoms we collect and we say, oh, you are suffering from malaria, you are suffering from plague, you are suffering from tuberculosis, because we take some of the symptoms which are characterizing one type of the disease, and we say, we verify it in the lab, and we go, oh, our diagnosis is good. We diagnosed it's a tuberculosis, and now in the lab we have found that acidophilus bacillus, which is responsible for producing the tuberculosis. Then perfect. But here there is a foolishness. There is ignorance, you can say. If not, the foolishness is just a hard word to say that, but ignorance. That how you can consider that, just like the parts I told you, the disease producing organism is the same, but individual persons are not same. They are the different parts of the color. And when you will add to them a unique color, a unique disease producing organisms, how you can expect that they will produce the similar type of things? So alum, borax, sugarcane, if they are looking similar, means up to that level, you diagnose tuberculosis, you diagnose pneumonia, you diagnose bronchitis, whatever you diagnose, that is the same thing. But the individual characteristics of every individual sick person will be individual. And you cannot use borax in spite of sugar. You cannot use sugar in spite of sodium chloride. If you cannot use all these things, alternatives, in spite of one to the others, then how it is possible you can use the same medication, just like quinine you use for malaria? How it is possible that you can use the same thing for each and every person, because they are individual? In this way, you can relieve some symptoms which are similar. Basically, you are suppressing those symptoms. and you are suppressing those symptoms up to that time limit until the body itself recovers from these things, or the source of reinfection, just like malarial tent or cholera or anything. Until that disease producing environment, disease producing organisms are now away from you, you are isolated from that. And if you are isolated from that, it means that disease ultimately the body itself is recovering himself. And if you want to help him, you are not helping the disease, you are helping the individual persons. This is what we have to think in mind. You have to help the individual sick person. And what's the individual sick person? Physically and mentally. Physically, symptoms, you have already taken that one: cold, shivering, cold, heat, fever, and sweating, and ultimately fever is gone. These are the physical symptoms. But if you closely watch every individual person suffering with the similar type or the same type of disease, you will see some of the individual characteristics are produced by each sick person. And those characteristics are necessary to be relieved, necessary to be selected medicine on that basis. Medicine should be selected not on the basis of this one, because you are not treating only the physical symptoms. The physical symptoms are only produced by the living beings. If the dead body is there, there will be no malaria. It means physical symptoms will not be there. And everything in the living being is because of he is having living principle inside it, power. And that power is individualized characteristics of every individual person. And then we have to give help, whatever that help is indicated by the symptoms, individual symptoms, not of the malaria, not of the tuberculosis symptoms, not of the cholera symptoms. No. If you see closely what the homeopathic doctors are seeing closely from the patients, that what are the individual characteristics. One thing, you diagnose the disease, you take the symptoms, and then ultimately you take the blood test and everything. Every doctor diagnose it. Oh, name the symptoms. After taking few group of symptoms, and they diagnose the person that you are suffering from this and this. That is the physical symptoms. But there are some individual characteristics which indicates or which separates sodium chloride powder from the sugarcane, from the borax, from the alums. And for every disease, we have to find it out, the individual characteristics of the person, because person is suffering, not the body. And if we help that person's, what type of individual feelings and characteristics he is having, and if you give the required help, what type of help this living being inside this body demands, and if you provide that kind, because we know the property of the drug substances, and there are many more substances which will be producing similar type of help which the individual person desires at that time when he is sick. When he is sick, what he needs, that's the characteristics. And we will be having medicines now. There's a big stock of the medicine and their individual characteristics, their active constituents. On the basis of constituents, we use the medicines. Some of the symptoms are the physical symptoms, some of the symptoms are mental symptoms, and the mental symptoms are basically the core internal power of that drug substances. The same way, the individual characteristic of the sick persons are the individual characteristics of that sick persons, and that is the main thing. If we know these important things, we will be able to cure each and every disease. This is the direct help of the body, because body itself, the individual living persons are itself capable of curing all the things, to overcome all the abnormalities like called diseases. But sometimes it needs help, becomes weaker, it needs help. And that need help we can provide with the medications, not by forcibly suppressing or forcibly, okay, you leave that, I will do that. I will bring, if you are shivering, okay, I will give something medicine, you will not shiver. But actually, the internal thing will not go, it will come again. It will come again until the internal, your vitality will overcome that process. And even when there was no medications, when there was no medical science, even then the person was having malaria, even then the persons were having influenza, even then the person was having tuberculosis and many other things, and they were surviving. Even nowadays, you have seen COVID-19, and that name as COVID-19. Not all the persons have vaccination. Even then, person survives. Not all the total immunity died with the COVID pandemic of the COVID. No, they survived because of their immunity, because of their individual power of survival. And the individual power of survival, what it needs, if you give him that kind of medications, that is more strengthening to the vital force, more principle, and ultimately it will recover soon from any disease, whatever may be the disease. Forget that, whatever the name of the disease, whatever color pot you are putting in all the pots, and every pot has the individual characteristics. And if you follow that characteristics, if you understand those characteristics, and if you give help to increase that characteristics, ultimately it will overcome the disease phenomena. So today's time is over. Any person who's having any problem, and you are getting treatment from anywhere, no problem. If you want to take your second opinion of the disease, you can call me at 408 687 1899. Or if ever you have any question, any understanding you want to, please call me 408 687 1899. My clinic address is 9701 Sarah N. Court, Dublin, California, 94568. Phone number 408 687 1899. There is no consultation fee for anything. If ever you are suffering from any problem and you want to take second opinion, yes, you can come to me, or even you can send your email to me, homeomedicine, HOMEOMEDICINE at yahoo.com, and you can get your answer for your disease, for your question, for your sickness concerning the health. So I can give you that one. And even if you are being treated from anywhere and you are not getting well, and you discuss with me, I can tell you what's the nature's process for curing these kind of diseases in the past. What the nature was doing, we are following that process, nature's process, so that we can get rid of the diseases, and very soon. God bless you all. We'll see you tomorrow at the same time from 5 to 6 p.m. California Pacific Standard Times. And tomorrow it will be in Punjabi, and after that it will be in Hindi. The same thing I will repeat, the individualization characteristic of the medicine as well as of the human beings. God bless you all.